Good afternoon. Welcome to the Think Transit First edition of Rochester Street Films. I'm Mary Staropoli from Reconnect Rochester, and I want to thank you for taking the time to join us today for a community conversation about transportation as an equity issue in our community. Access to reliable transportation is one of the most significant structural barriers that holds people back from escaping poverty. Our goal today is to ask, what can we do? What are we going to do about it? We'd like to thank the Rochester Monroe Anti-Poverty Initiative for co-sponsoring this event. Our MAPI provides the convening place to discuss systemic solutions to poverty. As co-chair of our MAPI's transportation subgroup, along with Bill McDonald, I can tell you that we've been working with many partners around that table to identify the policy solutions needed to make a tangible difference. But our MAPI is not where many of the necessary actions and decisions must take place. They need to take place within every employer, every nonprofit organization, every local government, and economic development entity. We want to recognize RTS for its phenomenal work over the last several years to redesign our bus system in a way that will significantly improve the frequency and reliability of service for those who depend on public transportation. The rollout of Reimagine RTS has been delayed due to the pandemic, but we're hopeful that we will see this dramatic improvement come to reality in 2021. But RTS alone cannot solve transportation equity in our community. RTS has limited funding and a large service area. They can't control where the jobs and services are that people need to get to, or our region's continued job sprawl. So that's why we're here today, to call for a widespread effort to relieve this burden on individuals and families. If we are serious about anti-poverty efforts, we must think about transportation. We must think transit first and not as an afterthought in our regional planning and organizational decision-making. Today, you'll see some great examples of organizations that are thinking transit first in the way that they're delivering services in the community. We'd like to thank our collaborators in the making of the films that will be featured today. Common Ground Health, Food Link, St. Joseph's Neighborhood Center, Catholic Family Center, Exercise Express, and Teen Empowerment. We want to thank the event sponsors that make it possible for us to put on Rochester Street Films. Our amazing media partner, WXXI, our premier sponsor, the Rochester Area Community Foundation, and all the other supporting and in-kind sponsors that are too numerous to mention, but we really couldn't do this without them. The program today is going to begin with a shortened version of our 2017 documentary film. And following that, we'll hear from Pete Nabozny, who will present some local data and statistics, and then we'll roll the new Think Transit First short film. And finally, a discussion with our panelists who will help us unpack it all. One practical note before we begin, if you wish, please use the chat to share your thoughts and insights with each other throughout the program. If you prefer not to engage in the chat, you can minimize it or drag it down to the corner so that it's not distracting or obstructing your view. And with that, please sit back and take in the first film.
Is the transportation system holding people down?
Oh. Hey, mommy's baby. Hey.
Hey, did the 24 come?
No.
It ain't come yet, the 124?
The 124 is supposed to be here 9:36.
It ain't come, it still ain't come?
If I spend this $700, $800 on this car right now, and then something happens to it in a week, and it costs $350, look, there goes the bus right there.
Yes, I would say the transportation system is holding people down. I feel like I know so many young people, so many adults my age and older that had good opportunities for employment, but just couldn't get themselves there on a consistent basis. And then again, the employer, supervisor, they might be understanding the first couple times you come late, but by the third or fourth time, they're gonna let you go, you know? And then even if you kind of get 3 or 4 jobs in the suburbs that pay well, you lose all 3 or 4 of those jobs based on you not having a way to really get there in a consistent way. Then you go for the 5th job. Are you gonna put those other 4 jobs as references for people to call, right? So now if you do put those down, they're gonna call, and the first thing they're gonna say is, well, Sean was a hard worker, but he could never get to work on time, or he missed shifts, which is gonna make the 5th employer say, well, no, I'm not gonna hire you, or I put down I have no work history, and then the employer will tell me, well, you don't have enough experience, right? And again, you try not to look at it like poor versus rich, black versus white, but I mean, we gotta be real, you know, all those things intersect the lives that we live, they impact the systems that we live in. I don't wanna think it's anything intentional that RTS, you're the only outfit in town, so I know you get all the pressure. I don't think you're doing it intentionally, but I do feel like the public transportation system, the way it's set up in Rochester, New York currently, is definitely holding people back from kind of reaching their full potential. Do you kind of think that transportation or lack thereof, the access to transportation, then affects people living in poverty or trying to get themselves out of poverty?
I'm always on a bus. That's what I'm doing right now. You know, that's just the reality of it. And if I was to talk about like the conditions that the bus are in now, and if that was going to make me progress, then I would say no, because it's like, you know, I'm saving my money, but I'm spending my money, you know, but it's like a keep on cycling. I just can keep on going before all of the jobs are all out there. Now I got to lower my income because I got to get this job closer. I have to, though. I have to get a job now.
I work a minimum wage job, $10.75 an hour. If we do the math on that, like I'm really not gaining nothing from this job. And I've been working for a year and I've yet to really save no money.
On the application, I know they say like, how are you going to be getting there? What's your form of transportation? And you put bus, okay? Automatically, they're going to look at where you live at and to where their location is, and you might automatically get put into the spot like, okay, he's a maybe because his transportation is going to be shaken. We know how the buses run out here.
The bus not coming on time, it kind of makes a problem for me because this can be my last straw.
Like money's always been tight for us because we never want anyone to fall short. Like even this morning, like, you know, I told my mom, I told her last night, like, yeah, I'm probably gonna do the videotaping thing for the bus in the morning. She's like, all right. So helped her cook and stuff last night, get the little ones ready. I know they got school coming up. And then so I told her, I was like, I'm gonna need $3 to get on the bus in the morning. And that's always a tight thing because it's like, okay, if I need $3 to get on the bus, then I know my 2 sisters need $3 to get on the bus to go to work, you know? So then it's like kind of one of those balancing things. It's like, well, I can't let the girls in them miss work and stuff like that because that's work. That's a source of income for the whole household. But then it's like, I understand you're trying to do this too, so let me see how I can balance it out. So what I told her, I said, okay, give me $3 to get on the bus. I'll get the all-day bus pass, and then I'll be back home before like 1 o'clock where they have to go to work, and then I'll just get my all-day bus pass. But the bus is a good thing for us because we only have 1 car, so there's been sometimes all of us have to go to work. We all got to work at 5 o'clock, all of us. Me, my twin, my 2 younger twins, and my mom. We all got to be to work. I work down there on Genesee Arnett, so that's that way. My mom's boyfriend works at the airport, so that's that way. My mom works at the Episcopal Church Home, which is over like by Plymouth area. And then my 2 sisters work at McDonald's out by Marketplace Mall. So it's like, okay, we got to figure out how we're going to get you here, and everyone has to be on time.
My son is an asthmatic, so if there's an instance where his asthma is acting up, I don't like to risk even waiting to catch the bus with him. I have to just go straight out and call an ambulance to come and pick us up, because I don't want his asthma to get so bad while waiting on the bus. It just takes so long to get places sometimes. Getting my son to the hospital, catching the bus, from wherever I'm at to my son's school and to the hospital, it typically takes me about an hour and a half to 2 hours. So it's just so much easier sometimes to just say forget it and catch the ambulance. I have to work around the bus schedule. Everything I do, I have to work around the bus schedule. Like, I wanted to go to Wegmans this evening, and I can't even do that because, of course, by the time I get back home, it'll be too late. I'll go there. It'll only take me maybe 10, 15 minutes to get what I need, but I will have to sit there and wait an hour for the bus to come back. And by then, it's going to be time for my oldest son to go to bed and, get ready for school in the morning. And like I said, I don't know if he's done his homework, so I have to make sure his homework is done and all that. So I just don't have time to, do that sort of things during the week. Chump. Oops.
I skipped class.
Be careful with that.
If you could impact one thing that will kind of change everything else, I really do believe it's like people living in poverty. I do feel like, the amount of money that comes into your family, that comes to your household, kind of helps determine in some ways the options you have in life.
No, I do not have any money saved up. I literally have $52 to my name right now in my account. Me and my boyfriend, we do want to get married. We plan on getting married. But it's hard to save up money to even plan for a wedding at this point, because it's just, we have so much to pay, and we don't even have enough money to buy our own car to get around anywhere. We have to catch the bus everywhere.
How much are you making?
$16 an hour.
Some people go from taking the bus or whatever, getting a job and taking the bus to getting a car. And then I know some people that just gonna be taking the bus forever, like probably me. And I'm spending damn near $30 on the bus every week just to make it to work. I don't see that. I don't see no solution as of right now.
I'll be honest, I got about like $100 saved up, but that's literally like emergency money, like emergency. So right now, what I'm really saving up for, I'm really saving up to get a car. Definitely saving up to get a car. I seen this nice two-door Saturn that I want only for $700. So I'm trying to save up my money to get a car.
And if you've kind of had, your grandparents maybe got some bad breaks and kind of got into a bad cycle, and then they had your mom and dad, and then they kind of inherited some of that stuff, and then they had kids, it's kind of like, someone's going to have to kind of like break the cycle. I think we got to do something different as a city of Rochester, state of New York, the country that is the United States, because I feel like we can all collectively kind of see that kind of way things have been going for the last 20, 30 years. Now, right now, don't really seem to be working too well.
All right, hello everyone. Thanks for joining us. I'm going to share my screen briefly to get this presentation going. All right, again, thank you for joining us. I'm going to kind of walk through some data about the intersection between transportation, poverty, job access, land use, some other things, just to kind of frame both the film we just saw, the one we're about to see, and then the discussion that we'll have afterwards. So just to, I think most people on this, in this conversation are familiar with Reconnect Rochester, but we're an organization that's really dedicated to improving and bringing about a more robust transportation network that makes it easy for everyone, regardless of physical or economic ability to get around. And that's what motivates a lot of the work that we do, our advocacy for greater investments in public transportation, for better planning around multimodal transportation, better bike infrastructure, pedestrian infrastructure, arrangements to help people, regardless of their circumstance, navigate this community and enjoy life here in Rochester. So what is the link between transportation and poverty? I'm going to explore that over the course of the next couple of slides, but it's our belief at Reconnect Rochester that transportation is a real key to addressing our tremendous challenge of poverty in this community. And if we can get our arms around helping people navigate this community in a better way, in a more comprehensive way, with more access throughout the community, we can really start to tackle some of the challenges that we have. But first, what is poverty? Poverty, I think, like dictionary definition wise, would be a condition of being, material deprivation, not being able to live up to a certain standard of living. But in the United States, when we talk about poverty, we talk about the number of people in poverty, we're really talking about whether or not someone's cash income from a variety of sources puts them above a certain level depending on their household size. And this was calculated in the 60s. And I know, looking at the list of people who are joining this call here, there's a mix of people with different backgrounds. A lot of people are very familiar with this, but just to level set for everyone. For a family of four, if you make less than $26,200 a year, you're considered to be in poverty by the federal government. And they determine this by kind of continually rolling surveys of households throughout the country in the American Community Survey. So what's been happening in our community? Over the last couple decades, and I picked 2015 because it's sort of lined up with the years here, although the trend kind of continues to today. We've seen rising poverty rates in this community. In 1990, we were one of the lowest poverty communities in the country, among the lowest. And now we're, as far as the city of Rochester goes, among the highest. And even Monroe County is really middle of the pack here. And everywhere, suburbs, city, we've seen rising rates of poverty. More people in our community, their income falls below that threshold that we just talked about. And poverty is not evenly distributed in this community. It varies quite a bit based on where you live and your age, among other factors. So children in the city of Rochester are more likely than not to be living in poverty. As of 2018, the 5-year data there, rates are lower, but still unacceptably high among adults, and then lower still among seniors. And that's mostly because of the Social Security program that we have. But really the big difference here is between the city of Rochester and the surrounding areas. And obviously there's differences between different parts of suburban Monroe County, but at this cut, you have this really pronounced difference between the city and the rest of the county. We also have tremendous disparities in terms of race and ethnicity in this community. Again, rates are higher in the city of Rochester than in the rest of the county, but among Black, African American, Hispanic, Latino, and Asian communities in Monroe County here, we have considerably higher rates than among non-Hispanic whites. And this is just something I want to highlight because I think when we talk about poverty a lot, we look at age, and that's something that's very important to me. My day job is a director of policy at the Children's Agenda, and we look at race, ethnicity, but there are a lot of other groupings that have incredibly high poverty rates in this town, and particularly people with disabilities. And there's transportation challenges associated with that. And I just wanted to highlight that here. Particularly, I think it's important to point out that children in the city of Rochester who have a disability it's about 2 to 1 are in poverty, which is it's the highest group I can find of any kind of subgroup within our community. Now, if you're working full-time, it is very hard to be in poverty in this community. Not impossible, but according to the Census Bureau, if you're able to maintain full-time year-round work, odds are very low that you'll be in poverty. And some of that's just a function of math. We have a minimum wage, and if you work the full year, your income is going to come in above a certain level. But I think it also points to it's key to be able to connect people to stable employment situations in order to help them, earn a living that gets them above that threshold and puts them on a path to more economic security. But what I also want to point out here is there are a lot of people in our community who are working part-time or part-year seasonal employment who do fall under that poverty threshold. And again, there's this big difference that we have between the city and the county. And we have that difference in among the category of people who did not work at all. And this is for all adults 16 plus, so this does include a lot of seniors. So moving more to the transportation side of things, household vehicle access is one big factor driving and reflecting some of this, right? This is a cycle. It's a self-perpetuating thing. If you need to have a car to access jobs in this community, and otherwise you'll be in poverty, well, that's both causing you to stay in poverty, but then it's a result of not having those resources too, right? So these are 2 different data points, but they point to very similar things. 25% of households in the city of Rochester have no vehicle available, compared to only 6% in the surrounding suburbs. And also importantly, 25% have fewer vehicles than working adults. So that's that situation that Nazir was pointing to in the film that we just saw, where there's a lot of carpooling going on. There's who needs the car this day, who can take the bus that day, how much longer are travel times as a result of that. And again, in the surrounding suburbs, the rate's just that much lower. And I think for a lot of people in this community, particularly those with even slightly higher incomes, they're driving to work every day. And in the suburbs in particular, over 90% of people who make more than 150% of the poverty threshold there are driving to work by themselves every day, as opposed to biking, walking, taking a taxi, or riding public transportation. By contrast, just over half of people in the city of Rochester who are in poverty are driving to work by themselves alone every day. And why is that? Well, because cars are really expensive. This is, I think, pretty conservative calculations. If you're able to get a used car at a good interest rate, which a lot of people who don't have great credit history would have a hard time getting, and sort of expectations around maintenance and insurance and license registration fees. Well, that, let's say rounding up is $5,000 a year, and that's a lot of, that takes a big bite out of someone's income when they're making minimum wage in this community. I still say in the past it was 25%, but the rising minimum wage has lowered that, which is, I think, something important to think about. So transitioning from those poverty statistics to where are the jobs in this community? What is the connection between job access and transportation options? Well, we have this shift that's happened over the last couple of decades, and this is the earliest data I could find from 2002, which showed that, roughly speaking, about 100,000 people, city residents, had jobs, and it was pretty evenly distributed between jobs in the city and jobs outside of the city. And the city is a good kind of measure for this, because we do have a robust public transportation system that serves the city really well. You may have to make connections and go downtown and all that, but you can get to most places in the city within some reasonable portion of time, particularly if the job is downtown. I want to just kind of preface a lot of this by also saying that the challenges that I'm talking about here are really outside the control of RTS. We've made decisions as a community around where jobs are, and it is very difficult, given budget restraints, for RTS to continue to always serve all of those areas. And what we've seen in those 15 years, from 2002 to 2017, is the number of jobs outside of the city held by city residents has remained pretty stable. It's actually gone up slightly, but the number of jobs within city limits has declined considerably. And that's a big portion of the challenge that we have in terms of folks getting to work. It's just in less transit accessible places. So this is sort of another way to look at sort of, I think, regionally kind of how the flows of jobs exist. 11% of jobs held by residents of Monroe County are for city residents who live and work in the city. More city residents, again, are leaving the city for a suburban job. We also have 22% of suburban residents are coming into the city every day for work. And then you have more than half of the jobs held in this community are held by people who live outside of the city. And some of this is to be expected. The population outside the city is bigger than it is inside the city. But in terms of where jobs are, who they're held by, it's a pretty small fraction that are held by city residents who live and work in the city there. So where do those city of Rochester residents, again, much higher rates of poverty, lower rates of vehicle ownership, where do they live, or where do they work, rather? So the big job centers in Rochester are downtown still. It's still the biggest job site for city residents. But then increasingly, this area around University of Rochester is strong, and then growing into Henrietta here, as well as up here in Greece, the north end of the city where RGH is. And then you see it's slightly darker. The darker the color, the more jobs there are there. You see, Hilton and Webster and a few other places. But predominantly jobs are still kind of in this main corridor here. So just isolating the 8 census tracts that have the most jobs for City of Rochester residents, we start to see some of the problem. The 2 biggest census tract job sites have actually low shares of low-income workers. And for the purpose of this, it's defined by the Census Bureau as someone making less than $15,000 a year. So that's part-time work typically, or seasonal work. And so these jobs that are downtown and by the University of Rochester, as well as RGH, a lower percentage of those jobs are held by low-wage workers. Further down in Henrietta here, that's where a lot of the jobs are for low-wage workers, as well as this kind of corridor here around East University, Village Gate, some of the other areas there. There's a good number of city residents with low-wage jobs who work there as well, which that is a pretty transit accessible place. But further down again here is it's stretching to travel from all over the city to that part of Henrietta, which is not designed for bus travel in the same way in terms of land use and layout. So just illustrate this, if one has a job downtown at the Hyatt Regency, which hopefully will be open again soon, it's a pretty short commute. By contrast, if you're traveling all the way down to Henrietta, you have a pretty lengthy commute. And if you think about that 2 ways and the number of buses that are running out there each day, that adds a tremendous amount of travel time to your life. And that works out in terms of if you add the commute time to what you're bringing home every day, there's a pretty significant sort of cost that's associated. It's kind of effectively lowering your hourly wage if you factor in that travel time. And of course, that's crowding out all sorts of other things that you could be doing with your life, pursuing an education, spending time with family, monitoring your children's homework, helping them with things. It's a real burden there. And so that is the trade-off, right? If you have to travel a long distance for work or for shopping, other things, if you have a car, you're saving time but losing money to a point where you may not be able to maintain that car, or it may be difficult to pay your rent because it's so important to keep that car, to say nothing of all the other fees attached with it. But if you're reliant on public transportation, particularly to outlying areas, again, where it's very difficult for RTS with its resources to serve, or has been, you're saving money, but you're losing a lot of time that could be spent on all sorts of things in your life. But it's not just about jobs. Transportation is a connection to all sorts of things that are essential to living a healthy, fulfilling life. And in some areas, we do better on this than others as a community. I think healthcare, generally speaking, is pretty centrally located in most options, and that's something that I know people pay attention to. I'd say quality food is on the other extreme there, where it can be difficult in large swaths of the city to access quality food and access it in bulk, so that the limited dollars that you have allows you to fill your refrigerator. And this is my attempt at sort of mapping that. This is sort of new for me, but I was able to pull down a file from the state open data site, and it shows retail food locations by square footage. And you'll see that we have these pretty large footprint supermarkets, right, that are really ringing the city, but they're not really in the city, with a few exceptions. And again, that can point to challenges people have, providing for themselves, their families, with the things that they need. And it also, it necessitates these long bus rides out to locations oftentimes. And I think any discussion of any issue right now is it needs to kind of take into account COVID-19 and what that's doing to public transportation. So we do have some data from the National Transit Database that shows a pretty considerable drop in ridership, which RTS has been sharing. It went from about 1.2 million unlinked passenger trips per month to just over 600,000 right now. There's a revenue component to that for RTS, right? It's half the fares, things like that. But it also shows that people are, not traveling as much by bus. A lot of people who have other options may be taking advantage of those options, but then, some percentage of people may be foregoing, things that they need to further their lives, which I think is also borne out by the really sharp decline in RTS Access paratransit ridership, which really dropped considerably for understandable reasons. In March, it has been steadily climbing back up, but it's still not anywhere near its pre-pandemic peak. So there are a lot of people who still aren't using that service to get to appointments, and again, that's concerning. I think also really significantly, COVID paused Reimagine RTS, which is this comprehensive redesign of the public transportation system in Monroe County. It was really deliberately designed to better meet the needs of a changing community, higher frequency service in core areas in the city of Rochester, ongoing commuter service outlying areas, but then really trying to bring about on-demand rides in key suburban zones. And it was accompanied by a lot of other things. The plan was to be accompanied by a lot of other things. I just want to say, RTS needs support of this community. It's our elected officials, everyday citizens. It will need to have sufficient resources to implement Reimagine RTS as designed. And I'm hopeful that we'll be able to do so, because I really do think it will change things in this town. And then what else can we do? Always invest in improved public transportation. Doing so allows all sorts of people to lead better lives, to be able to access the things in their life that bring meaning to them, and allow them to become more economically secure. I think we need to continue to promote policies that encourage density, job growth in the city of Rochester. Any economic development folks out there that are listening, finding ways to prioritize development in the city is really key to addressing our poverty challenge. In our suburbs, we also need to increase density in order to make things more accessible to people who don't rely on a vehicle or can't rely on a vehicle. More walkability, more bicycle infrastructure, and just designing our suburbs so that one doesn't need a car to always get around. And finally, listen to our panelists after this next film, because they have a lot of great things to add. Thank you.
Do you feel transportation is affecting people's health in Rochester?
Absolutely. Our health is really determined by our socioeconomic circumstance, by our environment, and by our behavior. And for that reason, it has really been fascinating for us to surface, to understand, and to share the important nexus between health and transportation. I really am struck by how clearly and how strongly we knew that the title of this report should be overloaded. What our data, I hope, is driving home is that it just sucks to be poor in this region, because problem on top of problem on top of problem weighs down on folks in such a manner that they have to start prioritizing how to use their available bandwidth. And unfortunately, in that competition of how do you make ends meet when you've got too much month and not enough money, attending to health falls down the ladder and compounds mental and emotional health stressors. And I think it is incumbent on those of us who are involved in delivering health care to have a heightened sensitivity to just how overloaded these patients are in terms of managing their health and the health of their children and the health of their loved ones. And we've got to think about how it is systems change can occur to help make life easier for them as they try and meet their daily and weekly and monthly needs.
St. Joe's Neighborhood Center is a healthcare center for people who are uninsured or underinsured or somehow just aren't able to afford the health care that they have. Quite a few years ago, St. Joe's Neighborhood Center started to keep track in some ways of what are called the social determinants of health. And transportation is one of the determinants of people's health.
We're very, very familiar with social determinants of health. We realize that transportation is a barrier for a lot of people. And with that in mind, I will take a client who is 20, 30, 40, maybe even 50 minutes late to accommodate them and get them the services that they need. I do understand that transportation is an issue. It is a problem. It's not a simple, let me jump in my car for all of my clients. They just don't have that luxury.
So when they first come into the neighborhood center and are screened to see if they're eligible for services, we ask if transportation is an issue. And if it is, we try to explore more of how it might be an issue for them, and then also see if we can address that.
And with that in mind, we're just a little more lenient, a little more flexible.
There are people who would cancel or not be able to make appointments because of transportation needs, yes. So sometimes they may not have enough gas to get to and from in their own car. Sometimes it's a matter of bus fare, or they might have had an all-day bus pass that they actually needed to use the prior day as opposed to the day of their appointment because they had other errands to run or some kind of emergency or something.
A lot of my clients actually walk. I get a lot of people from the Genesee Street area, Jefferson Avenue area, and they actually walk here because it's simpler to walk than actually to take a bus downtown to the transit center and then come on over to South Avenue. So that's one great thing I feel about the center is our location. It does give the ability for a lot of our clients, even from the Park Avenue area, Monroe Avenue area, they walk.
There's also just where you locate yourself as an organization and how do you get closest to the people who might most need your services. So that was one of the reasons why when we had started St. Joe's many years ago, the neighborhood was slightly different at the time, but we tried to be close to where people might be, so close to downtown on a bus line in a place where people might really need the services. And so that's a piece that I think many social service organizations could think about in terms of transportation, is not so much how do we get people to where we are, but how do we go to where people are?
Another finding, which is very clear, is we ask people about transportation being a barrier to accessing healthy food. And for households with incomes over $75,000 a year, only 2% tell us transportation is a barrier. It's at a third of respondents when we talk about those low-income households. And that's why groups like Food Link are essential in this community.
I think we think deeply here at FoodLink about the issue of poverty and food insecurity. Increasingly, we're trying to understand how transportation and childcare and these other factors in people's lives play a role. But for many years, we've felt powerless over influencing transportation. And so a program like the Curbside Market was our answer to that. If we can't build a grocery store in your neighborhood right now, and if we can't make sure you have a bus to get to the nearest grocery store, we're going to bring a mobile bus filled with really healthy product that you can afford, or you can use your SNAP benefits directly to you. And so that program has worked in that respect, but it certainly isn't fully meeting the needs, and it in some ways proves the need for a greater answer to transportation for our residents.
When we look by income strata, there's almost no difference in terms of the responses to folks who say, I agree that eating healthy is important to me.
Taking a bus to a grocery store that serves food that's not just convenience food, that is healthy and nutritious, that doctors are saying this is what you need to eat. Well, I don't have a way of getting there, and I don't have a way of eating this food. And if I have kids and I have to take these bags, and now I have new bags that I need to utilize to do this with, it's just one more barrier and one more barrier on top that our clients are having to face.
This isn't a values issue. This isn't a knowledge issue. Poor folks, just like the landed gentry, understand what healthy eating requires, and they want to eat healthy.
The Curbside Market program started back in 2013.
But it was really born out of an initiative we started 10 years ago, where we had a pop-up farm stand in a single neighborhood in northeast Rochester. And we reached a lot of people, but we realized how many limitations there were to just doing one single farm stand, and how much more impact we could have if we had a mobile solution to that.
You have to keep in mind, we are pulling right up to their door. They can come right on out and get what they, so it's the convenience that we're providing.
So currently Curbside Market pulls up to nearly 100 sites in the summer months and around 70 in the winter months.
So we do go to affordable housing sites, we go to senior day programs, we'll go to schools, we go to the YMCA or YWCA, and we also go to, like I said, federal qualified health centers.
I think what would surprise people is that we're in 5 rural counties as well, and we're also in low-income housing areas in the suburbs where people are also struggling with food insecurity.
It's like a store feel. You know, we set it up so that it makes it very easy for a customer to shop. After they shop, you know, we cash them out, and then boom, you know, they can just go on their way. They go right up to their apartment, put things away.
They're bringing the healthy foods right into communities, and so their Curbside Market is an incredible asset for how it is we help these families that really want to eat healthy have reasonable and rational means of doing so.
I think over the years we've proven that there's a demand for curbside. We have high sales at a lot of these sites, and it's caused us to open up more and more. So I think if you're a resident of the city of Rochester, there's a good chance you have reasonable access to a curbside market, but it's not a permanent solution. We go to each site one stop a week. So I think it still begs the question, how do people on a regular basis access their full range of grocery needs?
Folks in lower income households are very honest in saying that which they will to do, which is to eat healthy, is not that which they are doing.
Exercise Express, we just recently moved from 232 South Plymouth Avenue, and we came here with the collaboration with the City of Rochester. We work with individuals in the community that are in recovery, individuals that have mental health diagnoses, individuals that are low income, disenfranchised. From yoga, cycling, spin class, aerobics. We have a variety of workshops such as diabetes prevention program, medication adherence, and we have co-located with 2 other organizations. The other organization is Somerset Moon. She's a massage therapist. Also, we have a program with the Wish Center of the University of Rochester, and they offer clinical services to our clients. And, you know, it's easier for them to get to one location and have all those services be provided in one space.
I try to come every day, even when I'm not volunteering. I try to be here every day just because I like the atmosphere. I like the way people are treated here. I just love it.
I've been coming to Exercise Express for like 3 years now. I have transportation in the winter, but in the summer I ride my bike.
The majority of our clients that come to Exercise Express, they usually come via walking, public transportation. Many of our clients ride bikes to our services. Many of our clients have medical transportation. So when you put services in one building, it alleviates the transportation from here to there, to there, to there.
I come here a lot and exercise a lot because I suffer from anxiety and depression, and it helps me with that.
Going through a lot of depression in the last few years, and it's just a nice place to come and work out, and I made a lot of wonderful friends.
I try to encourage people to work out as much as they possibly can, even if they have those, issues, and we all have some type of issue. But working out helps tremendously. So if anybody want to come to Exercise Express, we're here.
I love it when the music says, I start all over again. I won't make you happy.
I think of as a community, if we're really serious about having equitable transportation, we need to have the long, hard conversation with ourselves that equal and equitable are not the same concept. So one solution that's going to work for one family may not work for another, and we need to be okay with saying this person might get what is perceived as more than another, because transportation is a need. Same as food is a need and housing is a need. Transportation is not a luxury. To get from one place to another, it is a need that in our society, I believe it's important that we help provide for everybody who needs it. And that's going to look differently for different people. For some people, a bus pass might be that solution. For a mom who needs to get their child to daycare or to school and then to their job, a bus pass isn't going to cut it. So we need to have that long conversation. What does equity and equitable mean across a variety of continuum of what we serve? And then we have to be committed to trying to provide that with the different options that are available.
Our services are offered strictly on walk-in. It's first come, first serve. Our doors open at 9. Most times to get from one side of the city to the other, it's usually about an hour and a half to 2 hour bus ride. So for those folks to get there by 9, they got to get on the bus probably by 7 in the morning. And if they have children, that can be pretty challenging. Not only that, by 9 o'clock, we already have a line at the door, and we serve the first 10 individuals that are there for financial cases. So if you get there and you're the 11th person and you just took a bus ride across the city, that's pretty discouraging. But if you had your own vehicle, you would have been able to be there fairly quickly.
And so because they can't rely on public transportation for that next step on the ladder, they have to almost take 3 steps back to go out there and buy a car. And then if that car needs repairs, they'll sometimes choose that over rent, because transportation keeps me going to my job. And if I don't have my job, then I don't have rent. And those decisions end up really setting families back, because those crises that come up with the car repair or then the pending eviction, they end up robbing Peter to pay Paul, and everything falls apart and they've got to start from zero. And that happens sometimes 2 or 3 times to somebody over the course of 3 or 4 years.
I think we need to first have a reliable public transportation. If we had that, people wouldn't be in the first place in need of buying their own car, which is draining much of their resources.
I think that we have absolutely tipped the culture in our community to say that the conversations we were having 10 years ago about transportation and its importance to health and to well-being, which were scoffed at or seen as a marginal conversation, have now arrived center stage.
It just impacts every aspect of somebody's life, just not having that freedom and independence to make your own choice on how to get from one place to another.
And that's been on our minds a lot, is just who has access to what and who designs those processes. Our lane is healthcare, but healthcare is absolutely impacted by transportation.
I really think it's a matter of us understanding how, as a community, the change that we'd like to see is not going to descend from the stars, nor will it roll in, as Dr. King said, on the wheels of inevitability, but rather it's going to take the tireless and persistent struggles of dedicated individuals. And I think that's what is one of the most exciting things to see in this community. If we can demonstrate that we don't necessarily need to rely on the personal automobile as the expression of freedom, but that what we really have is the chance to engage in a community transportation system as not only the expression of freedom, but the expression of community. I think what we wind up doing is truly transforming ourselves, not just in terms of our physical health, but again, in terms of our mental and our emotional well-being.
All right, welcome back. That was really great, and obviously pre-pandemic, but I think a lot of the lessons learned obviously still resonate today. Although it is jarring to see pictures in our community of people not wearing masks and being close together and all that stuff, right? So I'm hoping our panelists appear magically before us in just a moment, so I can introduce them because we'd have a great discussion lined up here. Here's a couple of them. All right, so thank you. I'll start to introduce Mike Bulger is the Healthy Communities Project Coordinator at Common Ground Health, HealthiKids Initiative. Larry Knox is the Political Community Coordinator for 1199 SEIU, upstate New York. And Denise Reed is the Director of Financial Assistance at Monroe County and one of my favorite public servants. So I'm glad she can be here today to join us for this conversation. So before I get into all of, I've got a bunch of questions for each of you. You guys are all experts in different areas. I first wanted to kind of give you the opportunity to, we've had first film clips, whatever I put together in my presentation, and then really that most recent film that has just a lot packed into it. So I wanted to give each of you just an opportunity to share your initial thoughts, having reflected on that. And I'll toss it over to Mike first and then move on to the other two.
All right, thanks for having me, Pete. And thanks for everybody joining us here. I guess my initial reaction is, first and foremost, what a tremendous job that Floating Homes Films and Reconnect Rochester did on these two films. Just not only such a wonderfully comprehensive look at such a terrible problem in our community, but just visually stunning, and the narration and getting all the voices involved that you did. Kudos to you. So it's an honor to follow it up. And so much was said within those films that it's hard to add to it. But I think my biggest takeaway is just how many ways and how many aspects of life transportation can affect. And I know that a lot of people on this webinar right now are working in different areas that are not necessarily transportation focused, but we see through these films how many ways transportation affects whatever it is we do, whatever lane we're in. And so the barriers are there from transportation, but I think also no matter where we work and what we're focusing on, we own a piece of that solution to these transportation problems. So that's sort of my takeaway, is just how interconnected it all is.
Great, yeah, absolutely. Denise, what were your initial thoughts after catching all of that?
So good afternoon, everyone, and thanks for having me. I agree with Mike about the kudos to you guys for the quality of the video, both videos, the shortened one as well. And the comments that I have really reflect back on that one, because we see that the gentleman, Sean from Teen Empowerment, talking about jobs and people not having the transportation to employment. And because we focus on here at the Department of Human Services, I'm really helping people get employed. We know, back to your presentation, living in poverty, particularly for people that are on public assistance, they are living under those levels that you put up the charts for. So we are encouraging people who are employable to be employed. And when employers come to us and ask us to, you know, connect them with job seekers, it is the first thing that we think about, is the job on a bus line, because we find often that the employer hasn't thought of that, but they come to us asking us about it, and they haven't realized that most of our clients will be using public transportation. And so in addition to whether or not the job is located on a bus line, you know, what are the times? Even just yesterday, right, we saw the new announcement that there's going to be, maybe this afternoon, an announcement that a major employer is going to go into the Rochester Tech Park. And we've been contacted by employers in the Rochester Tech Park as well. But the Rochester Tech Park doesn't have evening access, weekend access to public transportation. So we find that that is often something that we have to remind employers who come to us asking us to pair them up with job seekers. So we see that, and we try to bring that back to the forefront, to ask them to think of transit first, like you're saying. And we also we heard a lot in the video about the cost of transportation. And I think a lot of times we think it's just $1, but you heard the gentleman speaking about it really costs $3 a day. And what does that look like for a family if you have multiple people that are coming? And from a public assistance standpoint, you know, people have to get to our offices. I think Mike from St. Charles was talking about that, getting there. So, and our St. Paul Street office, which is our largest office with the most intake, it is located on a bus line, pretty frequent bus line. People can walk here from the neighborhoods that we serve the most, for sure. But when people leave, they have to still get to everywhere they're going to complete their eligibility process. And so depending on what those things are, our regulations allow for us to provide transportation sometimes, or gas allowance. You know, the allowance for transportation could be a bus pass, or it could be gas, you know, money for gas. So if the person has a car, so we do that, but not for all instances. And we have 50,000 households on SNAP, but we don't provide any transportation. There's no transportation benefit for the person to use that SNAP. And so those are the way that the programs are designed. And so thinking about that and thinking about transportation, and then just on a personal level, I could really relate to people talking about, did the bus come? I used to, before I was this public servant, Pete, you know, I used to be a young mother and have, and work as a home health aide. And so I would spend, and I didn't have a car, and I would spend, you know, 10 hours a day out of the house, catching the bus to these different home health aide jobs where I spent an hour and a half on the bus and 2 hours at the actual job. So, you know, I'm familiar with that for that reason. I'm one of those people who live and work in the city on purpose, because I remember those times. And while I have the luxury of a car right now, if I ever did not, I want to make sure that my walkability, or even my public transportation time is short. So those are my initial takeaways. Thank you.
Great, and that's also a great segue, I think, to Larry, who works with home health workers and among many others. So Larry, what was your main takeaway from what you've seen so far?
I mean, it all rang very true. I mean, there's, you know, you put out facts and figures and data, but those voices that people were speaking, that was very much borne out by the data that was there. It's very, very true. The conversations I've had with healthcare workers that work at nursing homes, especially ones that aren't in the city, and home care aides that work all over the county, all over the region, not near their home, that transportation is a major issue. And I think it's also important to realize, even like the concern that Denise brought up about employers not thinking about if they're on a bus route or not when they're looking for workers, and especially workers that are city residents. And there's also that, there's employers who have, jobs that are outside not on a bus line or for home care aides all over the place, and they're not paying them enough they can even afford a car. So it's like, you need a car to get out here. It's a lot easier, but you're not getting, income from your job that, enables you to do that. And even, you know, I know that I saw the numbers in there about, you know, if you're in poverty, you know, you're not going to get a 5% interest rate probably on a car loan. If you're very lucky, it's going to be, you know, those places that give you whatever loan, you know, we'll give you a loan. It's going to be 20%. You're going to be doing, you know, 60 or 72 months, and the car is not going to be the highest quality car. Hopefully, getting a hand-me-down car, but those, you know, have a lot more concerns also in regards to, you know, reliability. So I think, especially with home care workers, since they are going to different parts all across the community, they're not always going to the same location on the same part of town on the same day at the same hours all the time. You know, and Denise talked about from her experience that time that is lost, and what Wade was talking about of, you know, this being a stress on people, the healthcare, you know, not taking care of their health, and transportation being a stressor. It's very true. There's people that are literally, you know, maybe working 8, 10, 12-hour shifts, and then doing another 2 hours on a bus there and back, or waiting an hour for a ride, or because a ride fell through, they have to keep on working somewhere at their job because somebody else didn't show up, and then it cascades. Or missing family events because of a lack of transportation from work or to work. You know, there's lots of instances of our transportation, you know, minuses helping, hurting people in a way where they're trying to help themselves, and then there's another barrier put in their way with transportation. I think another important thing to kind of think about is that commute time, that not being paid, that loss of time that people have, it's a big deal. And I think it's sometimes lost, especially if you have a salary job or a job where, you know, your commute's that 21-minute average, I think, in the county. That time, that all that lost time that people have, and they're not making much as it is, they're living paycheck to paycheck. And then there's a lot of lost time from family and other events that you want to be there for. That adds a lot of stress and a lot of the issues that are come out in health later in life. Some of that, you know, one of those core points of reason, one of those core points of how that is started is the stress in your job in regards to getting there and back. But alone in being a healthcare job, especially this year with COVID, you're working in a nursing home, you're working in home care, the added stress of being in those circumstances. I know from our, you know, workers, you know, union and non-union, that, you know, people that have talked to, or people that have talked to them, that's a compounding stress this year. And even with RISE, before you used to carpool with somebody, now you gotta be more careful of that because of COVID, or just people are less likely to kind of, you work at the nursing home, I'm not sure if I'm dropping you off anymore. Or maybe, you know, there's all these extra things you're working. And I think that, you know, addressing that along with, you know, the poverty that undercuts, you know, not being able to afford a vehicle, and even the whole conversation of do we need more vehicles as opposed to changing, you know, the way things are, you know, being car centered. I think it's good that we're having this discussion, but we got to make sure we get to solutions because people are struggling, and those health determinants are going to get worse if we don't start addressing these issues.
Yes, let's talk a little bit about you know, some of those potential solutions. Mike, one of the things I know you're very passionate about access to quality food, and that being just a key issue that's affecting a lot of people. And you know, your boss there did a great job in the film, Wade Norwood, at speaking about that issue. But we did see, I mean, you know, FoodLink has put together this wonderful program to bring food to people, but they'd be the first to admit that that's a stopgap. They're doing what they can. What's the next step that we need to take as a community to ensure that people living in every corner of this county have access to you know, quality food that they can afford, that they find nourishing? What's on the horizon? What do we need to be doing next, and what do we have to do to get it there?
Well, it's you know, I like to say if it was an easy solution, someone would have solved the problem first, right? So it's a complicated question, and I think it's really going to take the sum of a lot of efforts to make real progress. And because of that, I think that we can't discount the smaller solutions. You know, it's tempting to look at a big box grocery store and a community garden and say, well, the big box grocery store moving into, you know, the North Clinton area or into Edgerton or you know, putting another grocery store where the Tops was on Lake Ave is the solution. But if we're not going to be able to incentivize those big box stores to come back into the city until there's, you know, more money in the city, right, and these jobs, then what can we do to really affect food security and access to quality food, right? And so maybe something like a school garden or a community garden starts to become, you know, a little bit more of a realistic solution, right? Like curbside market, it's not the solution. It's somewhat like a stopgap, but we're sort of starting to fill out the edges here. You know, could we bring, you know, more success to neighborhood farmers markets? Can we, you know, build upon what we're seeing now with the COVID response, which is, you know, we have an organization like Headwater Food Hub and FoodLink working together to bring local produce to city residents, right? That sort of higher quality produce that most people end up paying a premium for. Now there's funding because of the pandemic to try out some programs. Can we build this to be a more sustainable, long-term solution where we're really connecting the bounty of regional agriculture, of which we have here, with these neighborhoods that are right now terribly underserved? So there are a number of different ways to bring food to neighborhoods, right? And that relieves some of the burden on the transportation system, and it most importantly relieves some of the burden on these families who are having to juggle one car or no car and that time to get to their medical appointment, to one of their two jobs, to pick up the kid at one school across the city and the other kid at the other school across the city, and to try to be involved in their school, you know, parent engagement stuff. You know, every little bit, I guess is what I'm saying, is a step in the right direction. So there's no solution too small to these problems. And I think that one of the things that we can do as a community, especially around food access, is to start thinking about how different sectors like transportation, like business, like the school district, can work together on a problem that right now seems really dispersed, right? And I think transportation has the same issue in its own lane. So what we're doing with the City of Rochester and FoodLink is exploring what it would mean to have a food policy council in Rochester. And ideally, something like a food policy council would include stakeholders from the transportation sector, because like I've been saying, every opportunity I get, this is a complicated problem, right? And all these problems are interconnected. So we need to continue to have these cross-sector communications and these conversations as a community, and really think about how we can make solutions that complement one another.
Great, yeah, I certainly agree. Denise, I have a bunch of questions for you, as always, but one of those questions I have, you talked about it a bit when you were kind of giving your opening remarks, how employers they sort of come to you after they've made these big decisions. They've got this facility somewhere, they're looking to hire people. Are there, well, first of all, are there counterexamples where without, maybe you can name names if you want, but where you know that employers are really kind of thoughtful about bus schedules and locations and things like that, so that they can be supportive, and whether or not those employers exist, what are those, aside from just the kind of location of a particular job site, what are some of the other factors that sort of relate to transportation that you'd hope employers understand about the sort of needs and circumstances of people transitioning off of public assistance, trying to kind of maintain steady employment? What are those, transportation, and obviously what is connected more broadly to their lives around transportation, that you'd like, I guess, the broader community leaders, others, to kind of understand about what folks are encountering?
So right now I don't have any counterexamples, because most of them have been that they haven't exactly considered it. And even if they have, we were, in addition to the Rochester Tech Park one, we were also approached, well, we were approached by employers all the time, but one other particular instance where it was not a new build, right? So they looking to reach out to individuals living in poverty to open up some jobs at their office. And so they wanted to work with us. And we asked them, oh, you know, is it on a bus line? And they said, yeah, it's about a mile and a half away. So, you know, even that kind of didn't register that, you know, we may give you some people who a mile and a half that's too much. They're not going to make it. Even if it was feasible in the summer, it definitely would not be feasible in the colder winter months. So just for employers to even think about that and what times and the shifts are something too. I think you talked a little bit about, you know, bus schedule to Henrietta. It's very robust, right? But it ends at a certain time of day. So if employers are trying to fill later shifts or overnight shifts, sometimes that's just not going to work. And I, again, harken back to Sean from Teen Empowerment in the video to say, you know, having some flexibility, some patience. People may be late. If they're returning to the workforce after a while, they may not have backup systems in place. So you heard the young lady saying, did the bus come already? If she misses it, then how long before the next bus comes? Because it's not, you are dependent on the transportation and the transportation schedule. So we would like employers to understand that. And there are some, I shouldn't say there are no examples, just not directly that we've worked with. But of course, I think people on the call familiar with our mapping and some of the initiatives that they have, the YAMTEP manufacturing and the ride share and all the things that they've been trying to figure out for the people that they're serving to get to some of these outlying manufacturing jobs is commendable. You know, they are really thinking outside of the box and thinking about how they can get their people to those jobs when they finish. So we do work very closely with them and refer people to their program. But again, we struggle with people coming to us saying, you know, you have job seekers. You know, we have 7,000 public assistance cases. Another part for us too is just some unintended consequences. You know, right now, here's COVID. We're in the middle of COVID, and people don't have to come into our offices. The state government, the governor has issued waivers for us. So right now, for previous, if someone applied for public assistance, they had to do an applicant job search, and as a part of that applicant job search, we would give them transportation for that. Those requirements are waived, and so we don't see people in person, which is really good, but we also don't see them in person to give them transportation allowances. And so while they may have received a monthly bus pass from us to do applicant job search, they could have used that monthly bus pass for a number of things, to go to the grocery store, to go to the doctor, and now that doesn't exist. And so we don't see people in person, which is good during COVID environment, but we also aren't able to give them that allowance that might have helped them in other aspects of their life. And then the same thing for ongoing public assistance for individuals that are in receipt of public assistance. You know, pre-COVID, people might have been required to go to school or required to participate in some sort of employment programming, and we gave them transportation for that, daycare for those things. And now those things have been waived. And now the transportation part is not there, because the way the regulations say is you have to be involved in an activity to get transportation, to get daycare, and now we don't have people involved in those activities. So we will probably see, I think at the end of COVID, you will see some declines in some other areas because of that lack of transportation. And so when you think about solutions, you know, some other way to ensure that people can access public transportation when they don't have a bus pass. And we have explored some really promising aspects with our GRTA pre-COVID, of course, that we're hoping to revisit after COVID, help them increase their ridership for sure by getting access to transportation for the population that we serve, irrespective of a physical bus pass. So that, you know, pre-COVID, people would say, I lost my bus pass, or, you know, I didn't get it in the mail, or stolen from my mail. And so we're really trying to explore solutions where it's not dependent on that piece of paper, and we can figure out some other ways to work with our GRTA and our TS to get access to our clients.
Great. Yeah, you got a lot in there. Took all my questions from me. No, that's great. And glad you're able to give a kind of rundown of sort of what is happening within the county right now. Larry, one thing, I gave really brief introductions, but 1199 SEIU represents a variety of healthcare workers who work in a bunch of different settings, right? So you have folks who are working in hospitals, nursing homes, home care, and they have different needs. So there's some of those locations are on bus lines, heavily served. Others aren't. They may be out in the suburbs or different parts of the city. But so I'm hoping maybe you could talk a little bit about how those challenges present differently to your union members, and then also I know well, we all know healthcare workers are essential workers. They've been continuing to go to work throughout this pandemic and have continued to serve this community. And so I'm hoping maybe you could talk about what some of these creative solutions that you all have identified during this period, what we can learn from that for the future. But first, kind of how are the challenges different for different folks, and then what have we been doing about it, and what are some of those next steps that we could take as a community?
Yeah, for sure. I think challenges differ on employer. Some employers are better at addressing transportation issues than others. I saw in the comments there, one I think point maybe we can get back to later, just something to think about is, the poverty impact statements. I was on a committee with Finger Lakes. There was something between RMAP and Finger Lakes where it was kind of a co-committee, and the poverty impact statement was a very important discussion point. But if you're going to get federal money, state money, what are you doing to address poverty? And, there's a statement, could have been a little bit more detailed, but it was a good start in making sure people were thinking about that in regards to the populations they were serving, and are you actually paying enough so you can get to work, and transportation, is that a part of it, and all these other aspects. And some employers do think like that without having to be told, and some aren't. Strong, where we have a lot of members, obviously they're on the bus route. They, Strong has, worked with RTS to make sure, it comes right up next to the hospital, goes right up on campus. No matter the hours that people are working, there's usually a bus within not too far a time period of them being able to get off work and get there, during many different hours, and they are flexibly working with people around their schedules. And some nursing homes in the city that are right on the bus routes, it's been, employers, are able to work around their schedules. But if you have a place that is not off a bus route out in the suburbs, and the employer is not often willing to work with people around either calendaring them, setting their schedules around times where there is bus transportation, or helping them out with transportation, let alone paying them enough where they can actually, afford transportation on their own, either with the car or getting bus passes, or doing Uber or Lyft or something else. So there has been different parts, there has been conversations about employee, how do you supplement somebody getting to work, and especially with ride sharing, could that be an answer? And if there's an investment in ride sharing, does that turn back into an employee that's happier, that's more on time, which means better outcomes for patients and society in general? And it seems like from what we've been looking at and engaging in and studying, that does have a good, it's worth return on investment. It's morally right, which is why you should do it anyway, even if there isn't a money return in regards. But it's for employees and the larger employers, and for people in the healthcare field in general, from home care on to nursing homes, investing in that for your workers who need help with transportation, some kind of ride sharing support. It turns out, all of a sudden, lost shifts goes ways down, call offs are cut tremendously. People, having to be stuck at work because they have to have coverage, especially for somebody that's, let's say, 24-hour case with home care, where you can't just leave. And so you're stuck there oftentimes for a day or two until somebody could kind of come and cover, which is a tremendous, all those things are reduced a lot with some kind of, support from I think potentially from ride sharing. So that's one potential solution. And talking to large employees, large and small, maybe just them figuring out a way to support their workers more along those lines. Also, I think there is sometimes a misunderstanding. It's funny, Robin and from St. Joseph was talking about this. Oh yeah, she'll still meet clients that are 30, 45, 50 minutes late because she knows they were trying to get there. And oftentimes when we're defending somebody who gets in trouble for their job, fired or laid or suspended, and it's because of being late. Once in a while with somebody that's just bad, they're just bad because they're just not getting there because their own personal, difficulties that they could address. But oftentimes, majority of the time, it's really because I couldn't leave because my daycare fell through and I couldn't drop my kid off at my mom's house. And I'm taking the bus a half hour beforehand to get to work. And what's that decision they have to make? So a lot of times that I think employees aren't necessarily understanding of the difficulties they put their workers in regards to them trying to address their families first and still trying to get to work on time. So I think those solutions of having that be an understanding, the larger solution of, continue to put work out in suburbs where there's plenty, when the workforce, for jobs where the workforce is majority from the city, is it possible to have more of that work be on a bus line or be in the city? Or in a suburb even. It is kind of something that's more of a policy issue where we're working against our own interests of somebody wanting to put up another office park in whatever suburb, and then 90% of the workers live nowhere near where that location is. They're coming, from the city, on buses, maybe ride sharing, maybe, hopefully, being able to catch a ride with a coworker they met. So I think those are things that we have to address also with where we're putting these jobs and where the workforce is coming from.
Yeah, I couldn't agree more. So just a couple things to highlight as we're starting to wind down here, and I'll turn it back over to Mary in a moment. One, we have CEO of RGRTA, Bill Carpenter, in the chat there, weighing in, informing us that Reimagine, they're hoping to launch it next spring and summer, which is really great. And pleased to see that that's still on track. And yes, we will be sharing the presentation, this film, all of that as well. And I also I think some of the lessons learned from ride sharing in more suburban locations for your members, Larry, I think that's also part of the logic behind the on-demand service that RTS hopes to offer as part of Reimagine RTS, or is going to offer in select parts of the community here. And that also allows them to focus resources on, in the city where the ridership is highest and makes sense for the, the buses that we all see. And finally, I'll just also, we have been monitoring the chat. We're going to try to get, responses to questions and everything that we can put out later. And thank everyone for weighing in there. And I do want to just respond to one thing in particular that I hope that part of the takeaway from this today is that for us to have a community that serves everyone, where people can get around and have the resources that they need, we do need to invest in public transportation, in other modes of transportation. Given the economic circumstances of people, it's hard, nor is that necessarily going to help us address some of these other challenges. But we can't just say you don't get a car and we haven't put enough money into these other systems to serve you, right? And so I think any potential solution does need to kind of continue to involve more advocacy in Albany to get more funds into the public transportation system, so we can add service, different parts of the city, as well as allow RTS to expand on some of the great initiatives that they're trying to do, in the suburbs and to serve the whole town. So it isn't, of course, just redistributing the pie. I think we definitely need to figure out how to grow that pie in particular areas, while also thinking through some of these other solutions that Mike, Denise, and Larry all pointed to. So with that, I'll thank everyone for attending. I'm going to turn it over to Mary for some closing remarks, which I hope I didn't spoil by saying we'd share the film and whatnot. So thank you, everyone. And thanks to our panelists for a great contribution today. I really appreciate you guys taking the time.
Yes, thank you to our panelists, Mike, Larry, and Denise, for your time and for a very real, rich conversation. I really want to thank Pete, who fits in his dedication to transportation issues and his role at Reconnect amid his day job as the policy director at the Children's Agenda, and also, by the way, raising a family. So thank you, Pete, for all the time you spent on this. The two original films that you saw were produced in partnership with Floating Home Films, and I really want to thank Alex Weiser for your brilliance and for giving far more time than you're paid to give when you take on Reconnect Rochester projects. I also want to give huge credit and thanks to Monica Reifenstein, who's the wizard behind the curtain here producing today's event. And finally, thank you. Thank you for taking the time to be here. We hope you're inspired to dig into this issue, to think deeply about what more you can do from where you are, whether that's to bring the lessons of today back to your organization, or to raise this issue at the tables where you sit, or to join Reconnect Rochester in our advocacy efforts. One last thing, and that is please help us improve Rochester street films by taking a few minutes to fill out the survey on your way out of the Zoom. Thanks everyone again for joining us, and enjoy the rest of your day.